Authorities in Kano are taking proactive steps to prevent an outbreak of cerebrospinal meningitis (CSM) following the detection of 23 suspected cases in the state. Director of Surveillance and Epidemiology at the Kano Center for Disease Control and Prevention, KNCDC Aminu Sudawa, speaks to Trust TV on measures adopted to check against the spread of the deadly disease. The report.
Cerebrospinal meningitis is a disease associated with hot weather. Its common symptoms include fever, headache, vomiting, and neck stiffness. Dr. Aminu Sudawa stated that 23 suspected cases of the disease have been detected. This prompted state authorities to place health workers on high alert to prevent an outbreak through monitoring and public sensitization.
Currently, we have about 23 suspected cases and samples were taken to the lab. And once it is confirmed, then we know we are dealing with cases of outbreak. Meningitis is an infection of the meninges that surrounds the brain and spinal cord. And it happens at epidemic proportions, sometimes around this very dry season, usually between December and June. So now that we are in March, we are approaching a season whereby there is a possibility of the outbreak of meningitis.
He advised residents to avoid overcrowded places, ensure proper ventilation in sleeping areas, and maintain personal hygiene.
The public need to be enlightened, and one important thing is they should avoid sleeping in rooms that are not well ventilated. Rooms should have cross ventilation, and the crowd should be avoided, especially at night. People should not be sleeping in crowded areas. And government authorities that host people in high numbers, like barracks, like prisons, like boarding schools, should also be aware of this, and they should take necessary measures.
The law establishing the Kano State Center for Disease Control and Prevention was signed in February this year as part of efforts to protect the state from epidemics like meningitis, which recently caused 56 deaths in Kebbi State.